Fructosamine is a very important lab marker, yet very underused. Please allow me to explain. My name is Dr. Ennin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. Today, I am going to be talking about fructosamine. I just had a question from a patient that your doctor in the UK wanted to do a fructosamine test. So what is a fructosamine test? So what is fructosamine? So first, let's talk about A1C. A1C is your blood glucose control over the last 3 months. It's pretty much glycation of your red blood cells. So when our red blood cells is glycated, we test the red blood cell to see how much sugar or how much saturation of sugar there is, and that is your A1C. Fructosamine test is, however, is a measure of glycation of your proteins. You have a lot of proteins in the body. We have the albumin, we have the globulin, and we have other proteins. Albumin is the most abundant protein in the body. So as a matter of fact, clinically, while we are able to test A1C, where we want our A1C or our hemoglobin A1C to be less than 5.6, clinically, we can also test for glycation of albumin, and albumin we want it to be less than 14%. But if you are testing the whole amount of protein that we have in our bloodstream, that is the fructosamine test. The reference range for the fructosamine test is between 200 and 285 micromoles per liter. So that is the reference range. Now, when you talk about fructose, or when you hear about fructosamine, some people by the name you are thinking fructose, but it is really not fructose, but glucose. It is actually glucose glycation. Now, let me segue and talk about fructose for a minute. There is no direct measure of fructose glycation, and that is very dangerous, especially for the doctors who are advising that patients do fruit, because fruit has a lot of fructose, and fructose is more damaging than glucose. It is 7 times more damaging in the body than glucose, and yet we don't have a direct measure of fructose glycation in the body. Yes, and that is what makes fructose or consumption of fructose very dangerous. The surrogate marker that we can use in a clinical setting will be uric acid. That is the best marker that we can use to predict our levels of fructose in the body. And again, fructose is more damaging and more glycating than glucose in the body. So that is why I am not a big fan of people over consuming fructose-based foods, specifically fruit, because it can be very damaging and we cannot track it. The best surrogate marker, again, will be testing your uric acid levels. So getting back to fructose or fructosamine. Fructosamine is a glycation of all the proteins in the body. So when is it relevant to do fructosamine testing? In a clinical setting, if I have to do fructosamine test, I still do it alongside A1C. Yes, so fructosamine always has to be done in the presence of A1C. I like to have them side by side because it gives a better picture. It gives me things to analyze. It gives me reasons to solve the puzzle. So in a clinical setting, even though we use fructosamine when A1C is unreliable, I still want to see the A1C so it can give me a better picture. So when do we do fructosamine testing? In a clinical setting, I will order a fructosamine test when I want to see the impact of diet, exercise, and the medication within the last couple of weeks versus 3 months. If I want to go back to 3 months, then I want to use the A1C. But if I want to see something immediate on their therapy, on their diet, on their medication, then I'll order the fructosamine test. The other condition that will make me order the fructosamine test is when somebody is pregnant, when a narrow range of glycemic control is needed or required. So when a pregnant woman comes in, they are pregnant, I want to see their glycemic control before conception and after conception. So that is another area that I will order for the fructosamine test. Another area that I will also do testing is when we have the hemoglobinopathies, like the sickle cell anemia, like the hemolytic anemia, or when somebody has had a recent blood loss. These are the instances that I will be looking at the fructosamine testing. Again, I will do it alongside A1C. I will also do it when I want to see the impact of diet, exercise, and medication therapy within the last couple of weeks, usually within 6 weeks. So when is it not appropriate to do the fructosamine testing? But before I get into the specifics, I would like to talk about one reason why the fructosamine testing is not used routinely. And that is because in a very well-controlled diabetic case, the numbers overlap with the non-diabetic numbers. In other words, if somebody is diabetic, but it is very well controlled, their fructosamine values overlaps with somebody who is not diabetic. So pretty much you cannot distinguish between the two. So that is why routinely it's not used. And specific medical conditions can also affect the reason why we don't use the fructosamine testing. And the first instance is nephrotic syndrome, where you have a condition with the kidney or the nephrons in the kidney where you are losing a lot of protein, specifically albumin, that affects the albumin concentration in the body, and that can affect the fructosamine numbers. Keep in mind, fructosamine is the glycation of proteins. The second reason will be cirrhosis of the liver, because when you have cirrhosis of the liver, it affects protein metabolism, and that can affect the results of fructosamine testing. The third instance is dysproteinemias. This is when you have abnormal levels of protein in the blood that can affect fructosamine values. And for that reason, we don't do this test. And the last piece is when your albumin is lower than 3 grams per deciliter. The reference range for albumin, which is the most abundant protein in the blood, is between 3.4 and 5 or so. So anytime it's lower than 3, you do not want to be doing the fructosamine testing. So fructosamine testing is actually a very important marker when A1C is not reliable. And there are so many instances where A1C will not be reliable. In the next video, I'll be talking about why A1C may be an unreliable biomarker for blood glucose. And this is another pearl of health wisdom. My name again is Dr. E, as affectionately called. If you like this content, please don't forget to like and follow and share, and most importantly, subscribe so that we can keep this conversation going. I will see you in the next video. Thank you.